Hello, my name's Megan Burney, President and CEO of Unite to Light. Today, we're going to share stories of how light and power can drive innovative health solutions across the globe. We believe that clean, affordable light and energy are crucial to global health, education, and prosperity. We make it our mission to provide low-cost solar lighting and energy to people living without electricity. We do this by manufacturing best-in-class solar products and distributing them through on-the-ground organizations with deep community roots and a proven track record for success and impact. We provide people the tools they need to lift themselves out of poverty. Unlike many solar lighting companies, we are a nonprofit organization. We were founded in 2010 at the University of California, Santa Barbara, and in the last 10 years, we have distributed over 145,000 solar lights and solar charging devices to people in 78 countries. We prioritize last-mile communities and those who cannot afford even a low-cost solar light. We have over 100 project partners ranging from governments to international NGOs and purpose-driven companies. Our 4 primary focus areas are global health, disaster response, education, and homelessness. Our health programs equip midwives and community healthcare workers with the tools they need to save lives. Our disaster programs offer aid and hope to people suffering from natural and man-made disasters. Our education programs provide light to students to study at night so they can stay in school and graduate. And to our homeless neighbors, we are supplying light and power so they can connect to essential services. Today, I'm going to focus on how we met new challenges introduced by the COVID pandemic. Helping our neighbors experiencing homelessness has been a small, local part of our work for years. COVID changed that. As COVID hit the US, public buildings like libraries, as well as coffee shops and restaurants had to close. Our local behavioral health department and the United Way called to ask if we could donate solar chargers. Power was a key need for their constituents living on the streets. They needed energy to charge their phones in order to access services, stay informed, and safely shelter in place. We had just made a donation of several hundred units to our local Doctors Without Walls chapter. Unfortunately, they did not have the personal protective equipment at the time to distribute these units, but the county's behavioral health program did. We pooled resources and delivered over 300 solar chargers within a week of the request. At this point, early spring 2020, we knew access to energy would not just be a local issue. So we ordered more units. We started to identify partners across the US who could get our chargers into the hands of people most in need. Then we started to fundraise. We wrote grants, had a virtual 5K, and even tapped into our buy one, give one units. And people also came to us. The United Way tapped into their COVID emergency funds to purchase chargers, as did some other local governments. And from Boston to New York, Chicago to Tennessee, and San Francisco to Los Angeles, we ended up distributing over 3,000 units last year to people experiencing homelessness. And the impact was real. We've heard stories from people who were able to find a job, temporary shelter, food, and connect to family, all because they had access to energy to charge their phones. But as you might imagine, the need always outstripped the supply. One of our favorite stories, a story that we heard from almost every organization we worked with, was a story just like Kevin's in Chicago. Kevin is part of a small encampment. They look out for each other and share resources. Kevin received a solar charger from the Chicago Coalition for the Homeless and committed to sharing it with his community. In this way, a single unit helped multiple people. We heard this time and time again. People with so little doing so much to help each other. Some partners provide healthcare. And with medicine moving to telehealth during the pandemic, it became increasingly difficult to contact clients who live on the streets. The Harm Reduction Therapy Center in San Francisco found the chargers to be a strong point of connection. Their therapists engage clients from diverse backgrounds who oftentimes have low trust in mental health services. The therapists were able to use the chargers as a way to support the client's basic needs, which led to long-term therapeutic relationships. In this way, we hope that the benefits outlast the current pandemic. Global health was also impacted. We saw midwives and community health workers becoming frontline medical providers. They taught people about social distancing, hand washing, and the importance of mask wearing. They were often the ones that people came to when they got sick. One of our partners, the Maternity Foundation, which has app-based training for midwives, created a COVID-specific training program last year. And while their technology can transfer content from phone to phone, the phones still have to have electricity. We worked with them to get chargers to places like Haiti and Papua New Guinea. Education in places without electricity is always a challenge. As the world shut down, some of us were Zooming and attending virtual classes online. Others were trying to school from home in mud huts. We partnered with Child Fund and sent 2,000 solar lights to Sierra Leone and Honduras so that the students had a chance to succeed. A solar light means more hours to study and learn and a better chance not to fall behind during the pandemic. For each of these projects, we rely on two products, our Luke Light and Chandler Charger. Both are designed for people living without electricity. The Luke Light is a waterproof task light that gives 8 hours of nightlight for every day you have it in the sun. It is durable, compact, lightweight, and easy to transport. The Chandler Charger provides light and power for USB devices, from cell phones and tablets to fetal heart monitors. It weighs less than a pound, but will charge a smartphone 3 to 4 times when the battery is full. These units are small but mighty tools for fighting inequality and poverty. If you're interested in partnering with Unite to Light, please contact us through our website or email. Together, we can change a life and light the world.